this. Go ahead, and it sounds like people can hear us, people can see me. So I think we're on. So Tara, the fellow, facial plastics fellow, is helping out. Tara, you can go ahead and flip into the slides for us. All right, all about threads. Here we go. I'm going to talk about what these threads are. That's, kind of an important thing. They're going inside your body. You should know what they are. I'm going to explain why they're making a comeback. So these things were really hot in the early 2000s. So there's reasons why they died, and now they're coming back. So I'll get into that a little bit for you. And then I'm going to explain how we're used. So you could pause there for me, Tara. Yep, good. So this slide here is showing, I think the slide that everybody's seeing, it's showing that these are the threads I use. I mean, there's about half a dozen thread companies out there. These are my favorite three. It's kind of like fillers in the sense that we have a lot to work with. I think probably many surgeons can get good results with each specific type of thread, but it's really about knowing your tools, how to use them, when to use them, and in whom to use them. So those are the keys. So here I have Eurolift thread, Nova thread, PDO Max. I'll get into a little bit later. We have some good, Dane helped me out. He made some really good images to show you the actual thread and structure. Again, it's going in your body, so I think you should know what you're working with, or what I'm working with. All right, we can continue the slides there. We'll get through this is the boring part, so it's going to get better, I promise. All right, what are threads? You can pause there. So polydioxanone is the material. We originally used that material as a suture. It lasts around 180 days, so about half a year, 6 months. Same, half a year, 6 months. So it's slowly degraded and absorbed over time. That's good and bad. Similar to fillers, I tell patients, this is a good thing, this is a bad thing, right? What if you love it? That's good. Then in 6 months we repeat it. If you hate it, then you can let it wear away. These can be removed. They are kind of reversible in a way. I almost fell off the ledge. They are reversible. So that's polydioxanone. That's the material that's going inside you. They're synthetic. So they're made, in a laboratory somewhere, in a sterile laboratory. They're made sterile, they're packaged sterile, and we implant them sterile. The fact that they're synthetic essentially makes it affordable. Synthetic means that there's factories that can make these things over and over, so assembly line style. So therefore they're affordable, which is a benefit. These are monofilament. The ones I utilize, they're monofilament. So that's, if you think like a tree trunk versus braided hair, that's the benefit there. They're a little more structure being monofilament, and there's less risk of infection. Some of the theory of infection is when things are braided, there's little nooks and crannies for bacteria to be trapped in. So I prefer monofilament. I think most surgeons would agree. They're absorbable. So as I said, the fact that they're synthetic, that it's the polydioxanone, they're absorbable. Absorbable is good, bad, and a little bit indifferent in a way. The fact that it's absorbable means the body reacts to the product. So by causing some inflammation, you do build some collagen over time. So this is a very similar product to some of the fillers we use. So in a way, it's a biostimulator. So you create some volume and some structure in that area for the long term. Go ahead, Tara. All right, why are they making a comeback? This is the fun part. So they were really hot in the early 2000s. I think a big issue was, there's two big issues. They were way overused, meaning probably everybody was doing them who wasn't properly trained. So that's one. They were expensive. Actually, there's three. They were expensive. So it cost a lot of money for the companies to make them, cost a lot of money for the surgeon to have it in his office, therefore charge the patient a lot of money. And number three, they were way overpromised. So, people were telling, your brows will go up 4 millimeters, you're going to be happy, we're going to get your jaw snatch, you're going to look spectacular. They're using them in, thick skin, heavy 60-year-old people, when now, in the right hands, I'll get into it a little later, we select the right patients and you can get some good changes in the right people. Sorry, that's okay. So what can they do? Pause here for me, Tara. Okay, good. So I'm going to draw a little bit, Dane. You go live, Tara. Get me on the screen there. All right, great. So let's see. Dane, is this a good spot? Yes, for a brow? Okay, you can zoom out a little bit maybe. Good. So there's a brow. There would be a nose. The Chicago in the background for all those people watching from far. There's the eyeball. Good. So there's your brow, right? This is somebody's current brow position. The way these things can be used is it's like this fox eye that people talk about. You can really just get the edge of the brow, meaning one portion, the lateral most edge of the brow, to sneak up. You can get 1 to 2 millimeters. I have some really good images later where I'm showing some pretty adequate elevation in my mind. I don't know if that's showing up well. Yeah, it looks pretty good. So really the key is this lateral brow we can get elevated. And what patients will notice is the increased distance from the lateral canthus to the tip of the brow. And that looks good, you know. Hot is hot, as I said. All right, so go back to the slides real quick for me, or the video, or whatever you want to call it. Good, so what can they do? Fox the eyebrow, shape the nose, lift the cheeks, and define the jawline. I have a case kind of case presentation of each of these things. So you'll be able to see how I do it and how I'm able to deliver this type of thing. So go ahead, Tara. So this is a patient. She wants her brows up slightly. Here is the thread that I'm opening them up. Should be done sterilely, open sterilely, implanted sterilely, and in place sterilely. This is a smaller thread. Okay, keep going. And pause right there. I let it go a little bit more, actually. Good, right there. So this is a really cool photo. We have this super high magnification camera we use for research, and we were able to take some photos of a thread. This is a 19 gauge thread, I believe, and you can see the bi-directional barbs here. So Dave, come back to the live video, please. Get the live video there, Tara. Yep. Okay, good. Dane, go to a different area. Give me there. Good, that's perfect. And you focus. Okay, so you have a thread like this. Can you see that? Okay, you have a thread like this. You can kind of see it. So there's barbs, like fishhook barbs that go up and fishhook barbs that go down. So go back to the video. This is why the key to that is it really gave us flexibility in how we can deliver the thread. So I have a couple different techniques here I'm using on the brow, and they both work, and they can both be symbiotic in their delivery. So it just gives you a little bit extra oomph, which is one of the reasons these things are making the comeback, because the engineers, the doctors, the nurses, whomever worked on these things has learned. So there's the threads. Go ahead, play it. This is PDO thread again, bi-directional barbs, meaning one going up, one going down, another shot. All right, great. So here's our patient. I'm cleaning her off. We pre-sterilized, and I'm just a little bit anal about that, but I re-sterilized before I placed the port needle. These are 19 gauge, and they're blunt cannulas, so you just have to make a little port with a needle. Gently going in. The skin layers is more of a doctor talk. This is structured towards patients, but you're going just under the dermis of the skin, so superficial to the muscle there. And you'll see him going gently in. I blocked her before, meaning I gave her some lidocaine to really, make it comfortable. And then we're getting Topo Chico, not a beer. Next time. So we're getting them in there. Topo Chico is sponsoring this event, so that was a joke. So we're getting, the threads are in. Now you can see when I'm tugging on that thread, you can see the brow. And that's slight. So that's one thread placement. You can see how I'm bouncing the lateral tip of that brow. And next, a little bit later in this brow portion of the video, I have double threads in. I also come from the inferior to the superior, which is pretty cool to see. So look, she's happy. That's one thread. I mean, I've put 6 in people's brows before. So, everybody's a little bit different about what you need. Again, the key is who's putting it in. I mean, obviously when it's me, I'm going to say it's who's putting it in, but it is true. I mean, it's about the experience you have, the knowledge about the anatomy, the muscle attachments, the dermal fibrous attachments to the muscles, then to the skull. So all of that comes into play in your position and where you put the threads. In this location, I put the threads from the inferior to the superior. You can do both locations because these are bi-directional threads, so that's important. You got to know what you're using. So if you buy some on eBay from some country that doesn't have FDA approval, make sure it's bi-directional. All right. See how it's safe not to say another country? I'll get myself in trouble. All right, good. So that's the ones that we do both sides. We try to keep people symmetric when we can. So same thing, I'm going from top down. You'll see me with my left hand really, I'm putting a lot of pressure on there with my left hand. So the pressure is, some people kind of complain about that. You don't really know what's in it. It's a Topo Chico bottle, but you don't know what's in it. Okay, good. And then you'll see me really crank on her lateral brow to get it up. Good, they've just shown the threads there, but we have the zoom in view, which is even better. There's a good looking guy. And good looking girl. So she's checking them, it's real time. So we adjust them at the time of surgery or the time of placement. Showing this sterile thread, somebody else videoing that we were training. So, really, there's some key aspects to these threads. Real expectations. I think we're going to show her post-op views, and this is a good outcome. Not great, not spectacular, but it's a change. And if patients are down for this, then I think they're down for threads with this type of change. There's the thread coming out. You see me kind of tug it up. That's the fun part because you can really see it in movement. We had a little bit of a crowd that day. The other things I should mention, pause for a second there, Tara. Dave, can you come back to this thing? Come live. Good. Yeah, that's good. Get lateral there. Okay, right there. Perfect. So there's a couple other things you can do along with threads to really make a movement. If I put some volume within the brow and under the brow, you'll notice when you do the numbing, the brow raises a little bit. So also the orbicularis muscle is a sphincter muscle around the eye. It pulls the brow down. So if you give a little bit of neurotoxin to that muscle, it allows the thread to just be that much more effective. So sometimes I'll have people do neurotoxin a week before and then do the threads, and we can really crank it up if that's what you're looking for. Okay, there you go. Go back to the presentation there. Good. Okay, keep going. This one drags on a little bit, but the brows are the hottest, so I wanted to focus on it. There you go. Spectacular. So now, and then you cut the threads right at the skin, and then you got to kind of just bury it into the dermis a little bit by a little maneuver with both your fingers together. Lateral brow. And this, I've actually got a new technique that we're doing where it's like this double opposing thread. So any of the doctors or nurses out there, I'm happy to show you guys that. Requires a suture. Through the skin, you got to make a little incision in the skin. But in the right people in the hairline, it's a good procedure. And then her post photo should be coming up here soon. So that's kind of a gnarly look there. Oh, we're happy. She's happy. Not a bad procedure. Dancing. This is right immediately after. I'm showing her how good I am here. You can see a little bump under her skin. Most of that's inflammation. I have had to remove a few threads. They come on relatively easily. So, and because people can see the thread or they can see a bump. So, okay, pause there. So this is a real, this is a realistic outcome. And it's important because it's not, you don't send this photo home to your mom and be like, hey, look how awesome I am. But her lateral brow is up a little bit. You see how in the pre-photo on the left side of the screen and then the post-photo on the right, the brow kind of hooks down and then it's peaked up in the other photo. So go ahead, play. Real results, true expectations. My middle name. And zoom in, watch it. Bang! Pretty good, right? So, it's true. Pause there, please. Again, if you notice the frontal view, you can just look at the peaks of the brow, the lateral tips, the tips close to the ear. It's up slightly. These are, I think, 2 threads on each side in her we did. So, okay, go ahead, play. Dane was supposed to put, I'm the man, but he didn't do it. So. Okay, we're moving on to the nose. So we did the brow, now we're doing the nose. Pause it for a second. No, let it run. I'll talk while it's running. The nose, these threads in the nose are awesome in a couple ways. There's a structural component to these things. So the nose is a tripod. Most surgeons, doctors, nurses, everybody knows that. Patients know it too. So if you go, Dave, can you zoom in on my nose? Go live, please. Yeah, good. It's good enough. So you have the columella and you have the ala that goes sideways. The ala or the lateral nose. So I can put threads this way, up the dorsal. You can really, he's got his camera on a tripod right now. It's exactly what you can do to the nasal tip. And with that, I have a photo in here later of a patient. I'm rotating her tip up. A real smooth maneuver with these threads is to take a dorsal hump and hide that. And that's one we show here too. And that's, I don't want to say easy, but it's simpler. So those are some key aspects for that. So go ahead, go back to the video. I mean, you got to compare these to what our other options are for the nose. Rhinoplasty, you're talking a good month, 6-month downtime, swollen nose. I tell patients they're going to look like Homer Simpson for 2 weeks. Versus filler, there's a significant risk putting filler in the nose of going blind. I shouldn't say significant, but there is a risk of going blind. Oh, hold on, look at this. Boom. You see that, the dorsal hump there? That's what I'm camouflaging with the threads. And I put 12 threads in her nose, I think, which some people might be surprised at, but surprised? You know, that's what it is. So, and this is where there's really a good, it really has a good function, I think, to hide a dorsal hump. Also to change the tip rotation slightly. We'll get a photo. I'm gonna have you stop on that. All right, not yet. Okay, stop there. So when I have to put an arrow to show you my good work, it's not the best. But no, so it's subtle. You can see the white arrows they're pointing. She has this hump, and then it's just smoother. Subtle, but you know, is what it is. So okay, go ahead, play it, and then I want you to stop on the next patient, please. Yeah, so she was happy, you know, and that's what it's about. Stop there. So hopefully they can't see that thing. But if you notice, her nasal tip is a little bit projected, and it's a little bit rotated up. So a little bit projected into the nose and the skin. It's a classic thing that Asian patients, Hispanic patients, African American patients want because they have thicker skin. They have a bulbous tip, typically. So to project into that, threads can do a nice thing or a nice job. So she's happy, you know, that's good. All right, keep going. I think now we're going on to you know, the next area that I like using threads. Stop right there. So look at this is what every woman that comes to my office does that. Pulls their little finger up to their cheek, including my wife. Puts their finger to their cheek and pulls out. I just want this. So she wanted to get that kind of snatch jawline, a little sharper look. Go ahead, play it. I put threads in this location to pull vertically. I also put threads along her jawline to kind of snatch, so to speak. So once we get this in, once you get the thread, I'll have you pause it when I'm pulling on the thread there. Wait a second, I want to draw. Dan, you can come up here and get a good view of the mirror. Okay, pause it there. All right, look. This is a black marker. Okay, so oh, that's great. Okay, come over here. Go down. Can you come down to here? That's not gonna be right. Come back up high. Right there. Okay, so again, there's a nose, eyes there. We did the brows already. Great, Dan, that looks freaking great. Now, what people like, I say that in quotations because I just should. They like a little prominence along the cheekbone. They like a sharp jaw that angles down. So we're able to use the threads. You use a couple threads to, and again, I'll touch on this later. This maneuver works in young people that already have tight skin, that do not have sunken fat pads. It's got to be the right patient. Patient selection is key in this. And I won't do threads in people that I think they need a facelift or something more significant. So just remember that. So you pull up with 1 or 2 threads, do 2, and then you pull back with 1 or 2 threads. And you can use different size, you can do different angles. It's pretty slick. So I hope this stuff comes off the window. Saturday is gonna be pissed. It looks good actually. So all right. So that's what I have to say about that. Okay, go ahead and play. All right, so then I'm tugging at it a little bit. Here's a thread there. All right, good. You can see I'm really, and this is where I put a lot of pressure. I really pull the face up. A little dance. People do that on ticker tucker. Change my scrubs. This must have been, yeah, he's showing the threads. Remember that earlier image where you really zoomed in. Stop there. Great. So look at the angle of the jaw. So the posterior, towards her, just below her ear. See the increased shadow there, the sharpness. Her jaw looks longer. She has a little bit more of a shadow under her upper third of her cheek. There's some swelling, so you know, I can't take all the credit, but because this was immediately after, I believe. And I left the little feather thread sticking up. No, that's just an earring. So you know, you can change. It's subtle. Again, this isn't anything spectacular. This is a beautiful patient. I love her. I've done fillers and a couple other things on her. So It's not all threads. It's just a tool we have in our armamentarium. Okay, go ahead. So that's going to keep going. And then, great, another patient that I love. So a little bit of thicker skin, a little bit of heavier cheeks. So I wasn't sure that threads were the right option for her, but she really wanted them. But we got a nice little result. So I'll show the photos, her post-op photos at the end. But same thing in this kind of mid-cheek. Hers is that she doesn't have it, but she thinks she has this kind of early jowl or just that break in the jawline. People get this little, they start to see this kind of break in the line of their jaw. And that's kind of the pre-jowl, early jowl. So that's what she wanted. I did three threads on each side. I think we're just imaging one here. Again, you pull up. Oh, I must have already tugged on it there. But you kind of position the skin where you want and then pull nice and tight. And then the next photo the next image, yeah, perfect. Stop there. And then look, so same thing. You got to kind of, you got to kind of look for it. But there's a nice change in her neck and her jawline. I think it was worth it for her. She's happy. So I'm happy. Okay. Get some other views. How long we got, Tara? How long are we going?
Almost done.
Is there a timer on there? Good. Stop there. So same thing. Look at her jawline. Look at that kind of pre-jowl, just lateral to her oral commissure, to her lips. Like that's what she wanted open. And if I added a little bit of filler on top of this thread, she'd love it. So it's a good addition. Go ahead.
It's been 20 minutes.
All right. Okay, great. So now come back, big screen there, Dane. Okay, so those are threads. I think some of the key aspects are realistic expectations. So you got to know, or people have to know what the threads are actually doing. So there's a lot of poo-pooing threads out there from the medical community, from the surgeons. And I think they probably haven't played with them enough, or they're not putting enough threads in the right spot. I don't know, but I'm getting outcomes, and that's what it's about. It's about three things. It's about outcomes or results, safety, and it should be relatively enjoyable for the patient, for me, and it should be kind of a slick process. And I think the threads have the capability to do that, particularly for eyebrows and nose. I think they're pretty slick. Those are finer areas, and very small changes are noticeable in those areas. So that's why I think that there's a real utility there. The jawline in the right patients, like in that patient I showed there with nice, thin, tight skin, you can get a millimeter or two change, and that shows in her. Some patients, when they actually need a 2 centimeter, movement of their mid cheek, threads aren't going to work. So that's all I have to say about that. I'm signing out, I think. I'll wash the window. Okay, I think you can end it. Cheers.